Okay, so now the next thing I want to talk about is one of the things that we did is in Scotland, that's the only place that we've actually presented the data at the unit level. So once we looked at the international data, we then presented the data to the nurses at their unit level because we wanted to hear their stories, because story, based on that book, Maria's book, the story is used to understand, why are you here still? We want to understand what keeps you in nursing because we want to do more of that. So the reflective questions, what we do is we present the data, and it takes about 20 minutes to present their unit level data. And it's real easy to do if you use SPSS. You just split the file and run the analysis, and you've got all 18 analytics run for all the units at the same time. Create a template and you copy and paste. So anyway, if you want to talk more about it and get some help doing that, let me know. So the questions that we ask is, first of all, what did you find surprising? Because that gives us insight into what they weren't thinking about, but it can be very important. Then we ask them, what did you find most useful in the information? What was resonating with you? So then we look at that, and then based on that conversation, what action should we take? But there was something very interesting that happened. When I had gone in to present these top 3 questions and to ask them why they're staying, because the intent for this next year, 2024 to 2025, is to build measurement models that look at why nurses stay. And so that's what I was doing in Golden Jubilee, and Anne-Marie and Teresa will present more of that tomorrow. They have about 30 minutes to talk about that experience. But so then I wrote down all the reasons on each unit, and then I themed it out, and I'll talk about that. That's what I'm going to present. But what was interesting is about half the units, they didn't want to talk about what was surprising. They wanted to talk about the awful 3 years that they've just had. And so they said, can we just tell you what we've just gone through? And so after I had done a few units and they just wanted to talk about the pandemic, I'd just say, so how are you? What's going on? How was that pandemic for you? And then they had this cathartic discussion. We had nurses on verge of tears. We had nurses shaking. But then there were other units where I said, how are you? And they were fine, because that wasn't hard for them. But there were some units that it was very hard for, and they needed to talk about this. And what was fantastic is we talked about what was surprising, what was useful, what action should we take, why did they stay, and about how they are. And all that discussion was then, now where do we want to go? And so it was really helpful for developing action plans for them. Now what I want to do is I want to talk about how we build measurement models for turnover. So what keeps in retention. So we wanted to understand why nurses stay. And so I just want to show you that we use both quantitative, which is this Excel file right here. We use quantitative, and that's the profile of caring data. And then we have qualitative. So we ask them questions, and then we theme that out. And you can use those themes, like, for example, that helped us understand that the most rewarding experience from the organization is being thanked. How cheap is that, right? And so here, what I want to show you is once they have told us their story, then what we do is we talk about their reasons to stay. And so here I'm going to be using schedule as an example. So there were several that say, I stay because I have a good schedule. They have good staffing. So once we have listed it out here, for example, some of the comments were hours are good. One person said that. Historically, our ward has been well staffed. There were 2 people that said that. We have a supportive team and people help each other out. There was one that said that. So once we have listed their story, and you can see below that we have teamwork. So there were several people that talked about teamwork. There were several people that talked about leadership. But the staffing and scheduling, once you've identified the reason that they stayed, then you have to decide, how do I measure it? Remember, we can measure everything. We talked about we can measure everything. So now once you have listed why they stay, now you want to figure out, well, how do I measure that? So for example, with the schedule, we look at how many consecutive days do they work? How many hours total did they work? How many total worked per day on average? Do they have advanced posting? Do they have staff involvement in the schedule? What kind of schedule do they do? So all those things are approximations of good staffing, because you can't measure good staffing. I mean, you have to approximate it. So these are ways that you approximate it. And then it's important that you have the theory. What is my hunch? Why is that important? Now you can use formal theory, or you can use just a hunch and a belief, but it's going to be that hunch and that theory that will help you not only defend it scientifically, but it will help you interpret the results. Why is it we like this? This is what I had a theory about. Why isn't it like that, or why is it like that? And it will help you build your theory as well. And so then we identify the measurement level. Is it at the individual nurse level? Is it at the unit level or the hospital level? And so then once, and this is the same spreadsheet, just it was too big to put in one slide. And so here we identify what, if it's individual, what kind of scale do we use? Is it 1, 2, 3, 4, 5, 6, which would be scale? Is it yes, no, which would be nominal? Is it ordinal, like a different level of education? So there's rank, but it's not like a 1, 2, 3, 4, 5. So then you identify what measurement option, and then you identify, are there other ways to measure this same variable? So that gives you an idea how you move from story to building a measurement model to what's called data discovery, where you identify how do I measure that, and then you would eventually move on to talking to your IT people about actually pulling that together. Now, this is an actual measurement model. So this is the same thing. So here, for example, staffing and scheduling, see those 4 orange circles? This is a way where we take the list and now we put it in a model to communicate to others. These are the dimensions that we want to look at in all the constructs. So you can see here, teamwork, that was still a blue color. And then the leadership, we have that in the magenta color. And patient care is red, and professional growth is yellow. And then we have type of work is green. So it gives you an idea how some things were talked about a lot. There's lots of aspects about it, and then some of them only have a single item. But here you will see that some of these lines are filled. You can see that we have these filled in the magenta. We have these filled with the blue. We have these filled over here with the yellow. And that just tells us that the profile of caring, we already measure it in the profile of caring. Okay, so now you would want to see, is there other ways that we can measure these, what they call latent constructs? But this gives you an idea of how you identify, are we measuring it, and how to build the model. Now, this is very important. This is where Workforce Edge comes in. And they're going to, Sean and Jillian are going to be talking a little bit. But what is important about this is we want to pull in content experts on staffing and scheduling. And so I want Jillian or Sean to help me understand, how do I measure this from an expert point of view? And so then they would help me identify in their software and different ways that we would measure it. And this is called model specification. I've specified it for the variables that I understand are important. And the problem with model specification is we don't ever talk about it. We measure the patient, we measure the system, we don't measure the demeanor and the disposition of the employee. I mean, how crazy is that? That we think that the systems and the patient are going to grab all the predictors. Well, what about that person that's manipulating that ventilator or distributing the medications? If they have no well-being and they don't have clarity and they don't have good teamwork, who knows what safety looks like? But if we measure the patient, system variables, and the staff variables, then we have model specification. So it's really important that we specify the model for the context that we're looking at in healthcare. We need to be measuring the disposition and demeanor of our healthcare workers who are giving the care. So that's very important, and content experts are very important for us to do that. Now, this is called an over-aggregated model. You don't want to give them, you don't want to explain your measurement model to someone using this. That's just going to overwhelm them. So you just want to say, you know, we've identified 13 areas that are important, and then all the detail is hidden in there, okay? So you want to be able to communicate them. We want to study the outcome of retention, that's in the middle, and then you just have like a wheel spoke. You identify all the areas all around it.